Screening is the best way of identifying hidden tumors in our body. For breast cancer, screening is done by either a mammography or an ultrasound. Mammography is nothing but an X-ray of the breast where we can identify very small particle shaped calcifications. The character of these calcifications helps us to identify whether the lump in the breast or the hidden tumor in the breast is cancerous or not. Women who are younger, who have dense breast, may not be eligible for mammography. In those cases, we do ultrasound of the breast, which can help us pick up certain lumps and cysts. So I need to clarify one thing here, that many times there are lumps in the breast which are not cancer. So a woman who identifies a lump in the breast should not panic, because all lumps are not cancers, and so is true that all cancers may not appear as lumps. So all women who are above 54 years of age should go for annual mammography till the age of 65 years. Women between 40 to 54 have the discretion of going to mammography every 2 years. Beyond 65, if there is no family history, the mammography can be abandoned, particularly if all mammograms which have been done have come out normal. Apart from screening, the other thing which a woman should adopt is self-breast examination. Every month, particularly for those women who are menstruating, maybe 10 days after their periods start, you should fix a date where you should do a self-breast examination. We have already put in a video on steps of self-breast examination. You can go through that to apprise yourself on how to do it. Self-breast examination helps you to identify the texture of the breast, so that in case you develop any lump or small swelling, it will be in your notice at the earliest. The third thing which you should do is you should go for annual health checkups, where a clinical examination, where a doctor examines you, because there might be a difference in examination when you do it yourself versus when it is done by a doctor. So these three modalities, that is self-breast examination, mammography and clinical breast examination, are the key of identification of breast cancers in a very early stage. Because as the saying goes, a stitch in time saves 9. If we identify these tumors very early, we can save the breast, as we can go for breast conserving surgeries, and we can also reduce the quantity or the amount of treatment which might be required if the tumor is very advanced. So be aware, go for your screenings. Thank you so much.